Good morning friends. Today we are talking how vitiligo is treated without steroids. First we will see what is vitiligo, how it is normally treated, how they use the steroids, and how we can treat the vitiligo without using steroids. Vitiligo is a benign skin disorder where you lose the color from the skin. In the skin, there are melanocytes, which are color cells, which give the color to the skin. Vitiligo is autoimmune disease where your own white blood cells, they kill your color cells and they stop functioning, you lose the color from the skin. Then how to treat this? There are two ways of treating vitiligo. One is treating externally, one is treating internally. Most of internal treatment aim to correct your immunity. Now we have seen vitiligo occurs because there are some crazy white blood cells who kill the color cells. And to stop the overactivity of the white blood cells, we have to give something which can suppress the white blood cells. But remember, white blood cells or WBC is your immunity, and once you suppress the white blood cells, your immunity is suppressed. So mind well, whenever you take any medication in form of tablets, injections inside the body, there you have chances of side effect because the medicine has to go all along your body, it is digested, goes in the blood and then reaches the skin. It works on your white cells, red cells, liver, kidney and all other parts. So any treatment which is taken internally, orally as a tablet, capsule should have some side effect. Most of vitiligo tablets, they have the effect on the kidney, liver or retina or cornea, that is eyes. Very common treatment for the steroid to stop the spread is a steroid. Steroid suppresses the white blood cells. That gives very quick result. You take steroid, vitiligo stops spreading, you are happy. You continue the steroids, you get side effects like hypertension, diabetes, decreased bone density and so on. If you stop the steroids after some time, the disease rebounds. Rebounds means the white spots which are gone, they come back again. So the steroids, they are good to stop the spread, but they have side effect if you continue, and if you stop, you get the disease back, that is called as rebound. Is there any way where we can treat the vitiligo without using steroids? Yes. Either you have to avoid the steroids completely, or you can use the steroid in the safest possible way. Firstly, how one can use steroids in a safer way? Use minimum, only when necessary. Instead of tablet, give creams. Instead of daily tablets, alternate day dose is safer. Instead of alternate day, if you give say twice in a week, they are still safer. Better if you give once in a week, and still better if you give a dose once in a month. But still you will have some side effect. So instead of tablet, if you use a cream, that's better. What if you want to avoid the steroids altogether? Okay, steroids are useful for stabilization of disease. What is stabilization? Stabilization is stopping the spread. If steroid is a very good medicine which stop the spread but have side effects, I don't want to use steroids, what is the option? There is something called as external stabilization. So friends, vitiligo occurs because of faulty WBCs, that is immunity. WBC or white blood cells, they are in the blood, but there is a set of WBCs which come to the skin and stay inside the skin. Those are called as skin homing T lymphocytes or immunity inside the skin. It is not the WBCs in the blood, but is the WBC in the skin, they are causing damage to your color cells. So what if I suppress only the WBCs, the white blood cells inside the skin, and not bother to suppress the WBC inside the blood? Yes, that is possible. The latest way of achieving this external stabilization is using a variety of ultraviolet lights or radiations. So these lights come in various wavelengths. Usually they are in the ultraviolet range, and its combination, there are some specific combinations, some specific protocols they are tried. They help to stabilize the abnormal WBCs inside your skin. Meaning, even though your blood has a abnormal white cells, your skin has a very well controlled WBCs. So you can stabilize the disease activity in the skin in spite of having some activity, some problem, some disease inside the blood. So this is an external stabilization. Of course, it is a weak stabilization, it is a slower stabilization. So you need to take for 6 months, 1 year, 1.5 years. But once you take this external stabilization therapy for a year, year and a half, then it stays stable for 70 to 85%. At the end of the 1 year of treatment, it is a 70%, means 7 out of the 10 people they get stabilization of vitiligo, no spread of the vitiligo. If you take the treatment, say for 1.5 years, the stabilization rate is 85%, means 8 to 9 out of 10 patients they stop spreading. This follow-up period is variable. So friends, vitiligo, we can definitely control the vitiligo. We can bring the color back, and thirdly, we can stop the spread of the vitiligo very easily with steroids, but that has side effects, and with external stabilization protocol, very safely we can stabilize the vitiligo. So now no need to use a very high dose of steroids, no need to bother about the side effect of the steroids. Safer vitiligo treatments are available. Thank you very much.